Our spines are the backbone and foundation of our bodies. Made up of 33 bones called vertebrae, the spine protects our nerves, supports the torso and dictates our movements. Given the daily burden, the spine gets a lot of wear and tear.
Back pain is certainly very common. In fact, many studies have shown that up to 80% of the population will have back pain at some stage in their lives. Usually, patients present with acute low back pain. They, out of the blue, they may get a sudden onset of pain to the back. Now, in some situations, the pain may come on more gradually and become worse and worse. And they will have problems in either sitting too long or walking too long. They may suffer from too much of back pain. Now then, when these situations here, they find it difficult to lie down or sit down for a long period of time. Now then, and some patients, they may also experience pain radiating down to their legs as well. And they may experience some numbness going down to the legs.
Back pain persisting more than 3 months is chronic. See a doctor to rule out any serious medical problems. Pain may indicate an underlying condition like degenerative disc disease or a herniated disc.
Here, this is a model that shows that how a hernia prolapsed disc would occur. In this situation here, we also see that the nerve coming out of the foramina here, the hole here. Now then, the time when the disc protrudes out, it may presses against the nerve roots here, and this results in pain and sciatica. So here, the disc here presses against the nerve roots as it comes through the hole, and this results in severe low back pain.
Cervical or neck pain is another common medical condition. It affects the first 7 vertebrae comprising the cervical spine. These bones are surrounded by muscles, ligaments, and nerves. The discs between the vertebrae act as shock absorbers for the spine. Often due to a muscle strain or other soft tissue strain of the neck structures. These injuries can result from a car accident or from straining the neck, such as carrying heavy loads. Cervical spondylosis is another cause of neck pain. No age is immune to back pain. About 12% to 26% of children and adolescents suffer from it. Men and women are equally affected. Most lower back pain is acute and will resolve itself with or without treatment. If symptoms persist beyond 3 months, the condition is considered chronic. Most back pain occurs between the ages of 25 and 60. David has just finished national service in Singapore and is waiting to go to university in the United Kingdom. At just 20 years old, he has been diagnosed with disc degeneration.
Actually, I've had issues with my legs since I was a kid, and it's always been a bit hard for me to walk for prolonged periods. But I just, never expected it. I mean, nobody diagnosed it, nobody suspected. Just, one day kind of realized that, hey, there's something wrong. I've had it apparently for 5 years, but before a couple of years ago, I didn't even know that I had it. So basically, one day I just couldn't stand up, and I realized that the condition was getting worse, and I was officially diagnosed with disc degeneration. Well, it's not that bad yet, but I expect it to be much worse when I get older, because I mean, even now, it's not exactly easy for me to take a long walk or even jog down anywhere. So physiotherapy has helped, but it's not the most comfortable thing to have in the world. So I kind of miss the days where I could do anything and not really worry about what it's doing to my back.
What seems to be bothering you?
I'm having a few
The
problems.
effectiveness of back
Basically,
pain
whenever I'm
treatments
sitting for a long
varies from
duration
person to
or
person.
Standing for a long duration, I'm getting radiating pains. Starting
The
from my
doctor
back
will generally
and
begin
the
by
back,
asking
moving
about
down to the
symptoms
bottom
and taking a
of my
medical
arm.
history.
How long have you been having this now?